Here's why you still have H. pylori even after your antibiotic treatment. Hi there, my name's Reese. I have a master's in clinical nutrition. I work specifically with people who have reflux and they have bloating, and often I get the question, I had H. pylori confirmed as a positive test, I took the antibiotics and I still feel terrible. Why is that? Well, unfortunately, the antibiotics in a lot of cases, they don't work. And you know what they'll do? If you go back to them and say it doesn't work, they'll give you more antibiotics and more antibiotics and more antibiotics. And I think one of the reasons the antibiotic success rate is reducing is because people's microbiome is not as good as it used to. That's the collection of bacteria and fungi and archaea that live inside your system. So actually, when you take an antibiotic, you're reducing everything, which makes it harder for the body to deal with the remaining H. pylori. Now, with my clients, I use a supplement called pylori that I designed specifically to kill H. pylori because I had H. pylori and I did not want to take antibiotics and end up in that worst case scenario of you take the antibiotics and it doesn't work and now you have less beneficial bacteria plus H. pylori. So if you want to try something that isn't an antibiotic but still works to kill H. pylori, then I would try some pylori. Try it for 1 to 3 months, see how you go, but also make sure you open the capsules into water, swish around your mouth, gargle, and swallow for a couple of weeks because H. pylori can silently hide in the mouth and the esophagus, and if you don't open the capsules that way, it will not clear. Best of luck.